Thanks very much indeed for taking an interest in Bay of Plenty District Health Board. I'm Helen Mason, I'm the Chief Executive. What I'd like to do today is to share three things with you. First of all, to tell you a little bit about myself, then to tell you a little bit about our District Health Board, and lastly to share a couple of things that are really important to us as a DHB. The first thing that I'll do is explain my accent, which can be a little hard to pick. I was born in Ireland, I grew up in Africa, mainly in Zimbabwe, lived in Scotland for 6 years before we came to New Zealand almost 20 years ago, so the accent's all over the place. From a career perspective, I started my career as a nurse and a midwife. I come from a long line of nurses. My mum was a nurse, she nursed for 57 years, and both of my sisters are in medical professions. And I've been with the District Health Board for 18 of those years. That I've held a wide variety of roles with the District Health Board. I started as a casual nurse doing night duty and then moved into nurse manager roles and then into planning and funding and moved into this role of Chief Executive in 2016. As a family, we feel incredibly lucky to call the Bay of Plenty our home. And as a District Health Board, we're very, very proud of the Bay. That our District Health Board covers a broad land area. We go from Waihi Beach in the west through the main centre of urban centre of Tauranga, then up the coast past Te Puke and Whakatane, right up to the East Cape, past Te Kaha and Waiha Bay, and then the District Health Board goes inland as far as Murupara. We've got those two main population centres in Tauranga and Whakatane, but a lot of our district is rural, and the population in the east is quite different to the population in the west. In the east, we've got a very high Maori population. In the west, we've got a population which is growing really significantly. We've been traditionally known as a popular retirement destination, but in recent years, we're seeing that dynamic change quite significantly with very, very positive economic growth in the Western Bay of Plenty. From a funding perspective, each year the Bay of Plenty District Health Board receives in excess of $700 million worth of health funding from the Ministry of Health. That funding is used to purchase a whole range of health services. About half of it goes to delivering health services through Tauranga Hospital and Whakatane Hospital and mental health services and so on. The other half of the funding, in excess of $350 million, goes to providing a whole range of health services, and that includes primary health services through PHOs, general practice services. It includes dental services in the community, pharmaceuticals, laboratory testing, aged residential care. And you can see from that list of services which we fund that we've got really very broad accountabilities for delivering health services to our population across the Bay of Plenty. So our vision as the District Health Board is to achieve and support healthy, thriving communities. We really want our patients and their families to feel very comfortable about the care that we deliver to them and have a great experience of care. And we think in order to do that, that this also needs to be a great place for our staff to work. Our care values provide the foundation for doing that. The acronym CARE stands for Compassion, Attitude, Responsiveness and Excellence, and there are two of the values that I'd like to highlight. First of all, compassion. It's really important that the care that we deliver, wherever we do that through all of our services, is delivered with compassion and empathy to our patients and to their families. And then the second value that I'd like to mention is attitude. Very often people talk about having a can-do attitude, and can-do means that you've got the ability to do it, but you haven't made up your mind whether you actually are or are not going to do it. We talk about having a will-do attitude. Our staff's having a will-do attitude means that they're very, very proactive about making positive change and ensuring that we're delivering the very best services that we possibly can. Picking up on the theme of having a will-do attitude, we really encourage all of our staff to be very proactive about improving the way we deliver services. We believe that everybody's got two jobs to do their own job, but also to improve their job, so that we're constantly striving to improve the services that are available to our community. We really welcome your feedback, and you'll see that on our website that we've got, there's an option for you to be providing feedback on the services that we do deliver and on the interactions that you have with the DHB. We're really keen to be continuously learning and continuously improving the services that are available to our community. If you're wanting to get involved with the District Health Board, there are a number of ways that you can do that. We've got a great team of volunteers. It's a growing team. They've been recognised nationally with a recent award. There's information on the website on how to get involved as a volunteer. If you're wanting to work with us, we love having new people come and join us as a DHB to bring their new experiences and their new knowledge, and you'll find lots of information on the website about career opportunities. And the last thing that I'll mention is that our aspiration is to deliver patient and family centred care, so it's very important that we're working with patients and families to understand what really matters to them and to inform the design of our services. We've got an active group of patient advisors, and again, if you're interested in being a patient advisor, there's information for that on our website. Thank you very much for showing an interest in Bay of Plenty District Health Board. Kia ora.